Today we talk about diabetes. What is diabetes? How is it diagnosed and classified? Some risk factors for type 2 diabetes, management and therapies, and we'll tackle some frequently asked questions. The worldwide prevalence of diabetes has risen dramatically over the past 2 decades. So what exactly is diabetes? Diabetes refers to a group of common metabolic disorders that share the phenotype of hyperglycemia. Several distinct types of diabetes are caused by a complex interaction of genetics and environmental factors. Depending on the etiology of the diabetes, factors contributing to hyperglycemia include reduced insulin secretion, decreased glucose utilization, and increased glucose production. The metabolic dysregulation associated with diabetes causes secondary pathophysiologic changes in multiple organ systems that impose a tremendous burden on the individual with diabetes and also the healthcare system. In the US, DM is the leading cause of end-stage renal disease, non-traumatic lower extremity amputations, and adult blindness. It also predisposes to cardiovascular diseases, with an increasing incidence worldwide. Diabetes is likely to continue to be a leading cause of morbidity and mortality in the future. Glucose tolerance is classified in 3 broad categories: normal glucose homeostasis, impaired glucose homeostasis, or diabetes mellitus. Now, diabetes mellitus can be diagnosed by the following symptoms of diabetes, which includes polyphagia, polyuria, and polydipsia. Polyphagia is a scientific term for increased appetite, or when symptoms of diabetes plus random blood glucose concentrations of 200 milligrams per deciliter, or fasting plasma glucose of greater than 126 milligrams per deciliter, or an HbA1c of greater than 6.5%, or a 2-hour plasma glucose greater than 200 milligrams per deciliter during an oral glucose tolerance test. So what are the symptoms of diabetes? They are polyphagia, polydipsia, and polyuria. Polyphagia is a medical term used to describe excessive hunger or increased appetite. Polyuria is increased urination, and polydipsia is increased thirst. So diabetes is divided into 2 classifications. Type 1 is usually autoimmune in nature, and there is complete or near total insulin deficiency. Type 2 is impaired insulin secretion and increased hepatic glucose production. This is usually an acquired disease. Diabetes is the leading cause of end-stage renal disease, non-traumatic lower extremity amputations, and adult blindness. Listed here are some risk factors that predisposes an individual to developing type 2 diabetes. Family history of diabetes, if you have a first-degree relative like your parent or a sibling, if you're overweight or obese, physical inactivity, previously identified impaired fasting glycemia, impaired glucose tolerance, or an HbA1c of 5.7 to 6.4%, a history of gestational diabetes mellitus, hypertension, so blood pressure greater than 140/90, an HDL cholesterol level less than 35, and a triglyceride level greater than 250 milligrams per deciliter, polycystic ovary syndrome or acanthosis nigricans, and a history of cardiovascular disease. Overall goals of therapy for type 1 or type 2 diabetes includes the elimination of symptoms, decrease long-term microvascular and macrovascular complications to achieve as normal a lifestyle as possible. And this will require the patient's participation, their input, and enthusiasm. Some frequently asked questions. What should my blood sugar be? The American Diabetes Association recommends a blood glucose range of 80 to 130 milligrams per deciliter before meals, and less than 180 about 2 hours after a meal. So this range will make sure that your HbA1c is under 7%, which is ideal. So the second question is, what is an A1C? So a hemoglobin A1C is a 2 to 3 month average of your blood sugars, and this result gives you a good idea of how well your diabetes is being managed or controlled. So the American Diabetes Association, they recommend an HbA1c of less than 7% to keep the risk of complications low. The third question is, what can I eat if I have diabetes? You can eat just about anything you want. It is about knowing proper portion sizes and how much you are putting on your plate. So a dietitian can help you learn to count carbohydrates and with meal planning that is specific for you. If you want to check out my other video that I made on diabetes meal planning, I will put the link in the description down below. The next question is, do I need to follow a low-carb diet? So carbohydrates are an important part of a healthy diet. Now with diabetes, watching portion sizes and getting most of your carbs from fruits, vegetables, whole grains, and low-fat milk and yogurt is key. Besides counting carbs, people with diabetes can also benefit from eating lower fat, high fiber foods, and just enough calories to maintain a healthy weight. Question number 5. If it is sugar-free, I can eat as much as I want, right? The answer to that question is sugar-free foods can be a part of a healthy meal plan in small amounts. Remember portion control. Keep in mind though that some of these foods still have carbs in the form of sweeteners such as sorbitol, isomalt, and mannitol, and may affect your blood glucose levels. Many sugar-free foods have calories and carbohydrates and lots of fats. Make sure you read the nutrition labels, and remember, meal planning and portion control with an overall healthy and active lifestyle will keep your HbA1c under 7%, keeping your overall risk for developing complications associated with diabetes significantly lower.